Mr. O'Rourke?
Thank you, Mr. Chairman. To the Chairman of the Commission, can you talk a little bit about the recommendation to improve collaboration between the Department of Defense and the VA? And I'm specifically interested in the recommendation that there's a unified health record, and I think your recommendation is to use the VA's healthcare record through their VISTA system. But if that's not the case, correct me. And tell me whether that's going to require an act of Congress or whether DOD and VA could administratively implement that recommendation, because along with other members here, I serve on the VA committee, and that has been a significant frustration for us, the disconnect between DOD and VA on this.
Congressman, thank you for the question. We spent an inordinate amount of time amongst ourselves discussing the benefit of having better collaboration between DOD and VA. We've actually spent time talking to the Secretary of VA. We've spent time talking to people within the Department of Defense regarding the position that they've taken on moving forward with their health care, the electronic health care record, the way they want to approach it. We know that there are a lot of money that is spent between DOD and VA on how they do business. We believe that we can take better advantage of the taxpayers' resources if, in fact, we had better standardization, shared services, we had better ways of actually of conducting business between the two. I'm going to ask, because we spent so much time on this, and I know that Commissioner Boyer spent a lot of time when he was here, and since that time he's been one of our lead in following through on these things in our discussions. So I'm going to ask him if he would please respond briefly to that as well.
Thank you.
Well, thank you for your service on the Veterans Affairs Committee, along with Sergeant Major and Chairman Miller for your years and your eyes on Recommendation 8 on the collaboration. We looked into this on the JEC, so the Joint Executive Committee. We didn't put it in our recommendation, but after having met with Secretary McDonald, I do believe they're correct. Try to achieve parity there at the committee. Right now you have the Deputy Secretary of the VA meets with the Undersecretary for Personnel. It really should be the Deputy Secretary of DOD meeting with the Deputy Secretary of the VA. So I would ask that establish a parity and put it in statute. And the other is with the Joint Executive Committee, it's what we talked about on the committee about a heterodox. When someone has, you've given them a position, they have the authority, but they have no power to perfect or implement. And that's exactly what the Joint Executive Committee is. So we try to get these two departments, the VA and DOD, to collaborate, but they can come up with great policy, they can come up with great recommendations, but they have no power to implement it. So what we're asking, Chairman Miller, is, I'm sorry, we're asking, I'm talking to him because he can get this done, and you are also on the committee, pass it and make it law that they can actually implement. So in the areas on mental health, that you can actually blend those mental health drugs, we're not going to dictate to you, nor should you dictate to them what antipsychotics, antidepressants, pain medications, let the experts, let science lead, but then make sure that can happen. With regard to capital projects, you know, never again should there be that situation down in El Paso where the Army builds an Army hospital and VA builds a hospital and they won't put it on the same timeline.
Yeah, you know,
I'm sorry.
Let me
so making sure that committee has the power is important. I
represent the community of El Paso, and I wish they were building a VA hospital there, but it is alarming that we're spending $1.1 billion for an Army Medical Center, state-of-the-art, with no provision made for the 80,000 veterans who live in that community, who are going to be stranded at an existing clinic that today is co-located with the Army Hospital, the new one's being built 9 miles away. So the benefits of these recommendations are obvious. Is there a specific number in terms of the savings of using a single medical record, of collaborating when it comes to purchasing for medication and pharmaceuticals? Is there a dollar amount associated with this recommendation?
The answer to the question is we don't know exactly what that dollar amount is, Congressman. We didn't go that far that's not the kind of thing that we really looked into that deeply. We had discussions about it. We know that there would be some savings there if the processes were more streamlined, but we don't know what the extent of that. We'd be happy to look into that for the record.
Yeah, it makes a lot of sense. Thank you for the recommendation. Thank you, Mr. Chair.
Thank you.